look muscular and pinkish. The uvula should be pink, midline, and free of lesions. Next, inspect the tongue. The dorsal surface should be symmetrical and slightly rough, with a midline groove and small fissures. The ventral surface should be smooth and pink, with visible veins. Using a gauze pad, hold the patient's tongue to one side and palpate the floor of the mouth. You should feel no lumps or indurations. Next, ask the patient to stick out his tongue. It should be midline and free of tremors. Place the tongue blade at the side of the tongue and ask him to push it away. Tongue pressure should be equal on both sides. These actions test the hypoglossal nerve. Check the glossopharyngeal and vagus nerves by depressing the tongue and having the patient say, ah. The soft palate should rise symmetrically, and the uvula should stay in the midline position. Instruct the patient to say, ah, again, and assess the pharynx and tonsils. Their mucosa should be smooth and pink. Grade the tonsils' size on a scale from +1 if the tonsils are visible to +4 if they touch each other. If the patient reported an impaired sense of taste during the health history, assess his facial and glossopharyngeal nerves by having him identify different flavors.
Now tell me what you taste.
Cinnamon.
That's right.
Lightly touch the back of his tongue with the tongue blade. He should gag. This test assesses the glossopharyngeal and vagus nerves.
That's what it was supposed to do.
Now you'll assess the neck, beginning with inspection.
I'd like you to lower your gown. I'd like to look at your neck.
Okay.
The patient's neck should hold his head erect and midline. It should have symmetrical muscles and no swelling or masses. If you see swelling below the jaw angle, palpate this area to check for a parotid gland problem. Now assess the neck's active range of motion by having the patient touch his chin to his chest, turn his head to the right and left, tip his head toward his right shoulder and toward his left shoulder, and tilt his head backward. All of these movements should be smooth and
I'd
painless.
like you to sit up straight, put your shoulders back.
Next, assess the spinal accessory nerve.
What I'm going to do
Apply
is
resistance to the patient's shoulders as he shrugs them.
shrug your shoulders.
The shoulder muscles should be symmetrical and able to overcome your resistance. Now have the patient turn his head to one side as you apply resistance to the side of his chin. Then have him turn his head to the other side as you apply resistance to the opposite side of the chin. Note the contraction of the opposite sternomastoid muscle and the force of the movement against your hand. Movements should be equally strong. Next, move on to the lymph nodes in the neck. With the finger pads of both hands, bilaterally palpate the nodes using a circular motion. Palpate the lymph nodes in this sequence: preauricular, posterior auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Note the size, shape, consistency, mobility, and tenderness of the nodes. Be sure to compare one side to the other. Normally, the lymph nodes are small, soft, non-tender, and movable. If you detect swelling or tenderness, search for a possible cause. Now inspect the jugular veins using tangential lighting. With the patient supine and his head elevated 30 degrees and turned away from you, internal jugular vein distension may be visible. Observe the jugular vein pulsations. They should undulate softly and may decrease with inspiration. Note unusually prominent pulsations. Now, with the patient sitting up, identify the trachea by locating the sternal notch and sliding your fingers to each side of it. The trachea should be midline and symmetrical. Stand in front of the patient. Use the fingers of your left hand to push the thyroid gland to the right. Curve the fingers of your right hand between the trachea and the sternocleidomastoid muscle. Then ask the patient to extend his neck and swallow.
Extend your neck.
You should feel
and
the
swallow.
thyroid move up and down as he swallows. Then palpate the thyroid gland from behind. Place the fingers of both hands on the patient's neck with your index fingers just below the cricoid. Palpate both lobes and the isthmus. Instruct the patient to sip and
Like you
swallow
take
during the
two sips of
exam.
water and swallow while
Note the
examining
size,
thyroid.
shape, and consistency of the thyroid. If the thyroid is enlarged, auscultate it for bruits with the bell of your stethoscope. A bruit is a blowing sound caused by turbulent blood flow.
Good, that was fine.
Next, observe the carotid arteries
Straight
for
ahead.
visible pulsations. Gently palpate the carotid arteries using your index and middle fingers. Remember to palpate one carotid artery at a time. Otherwise, you could block blood flow to the brain. Don't press too hard over the carotid sinus area located higher in the neck because this could cause vagal stimulation, which could slow the patient's heart rate.
Now I'm going to listen to
Next,
the
have the patient take a deep breath and hold it as you listen to the carotid artery with the bell of your stethoscope. You should not hear a bruit. To assess the thorax, ask the patient to breathe normally as you observe his respirations. Respirations should be regular and symmetrical, and the accessory muscles should not be used. The patient should breathe comfortably while sitting with his arms at rest. Now move around slowly to the patient's back. As you do this, assess the anteroposterior and lateral diameters of the thorax. Normally, the lateral diameter is up to twice the anteroposterior diameter for a ratio of about 2:1. Still standing behind the patient, use your finger pads to palpate the spinous processes. They should be evenly spaced and non-tender. Next, assess respiratory expansion. To do this, place your thumbs at the level of T10, or the 10th thoracic vertebra. Spread your fingers, allowing for small folds of skin between your thumbs. Ask the patient to take deep, slow breaths. As he does, watch your thumbs move with respiration. Their movement should be symmetrical. Next, assess for tactile fremitus, or voice sounds palpated on the chest wall surface. Using the ball of your hand, feel for vibrations as the
99.
patient repeats the phrase 99.
99.
Move from the apices inside the
99.
scapula down to the lower and lateral
99.
thorax. In each location,
99.
you should feel equal vibrations.
99.
Now perform mediate percussion using a systematic pattern so you can compare the two sides. Resonance should be equal over the lungs. You should hear dullness over the diaphragm. Hyperresonance means you found an area of increased air in the lung or pleural space, as with a pneumothorax or acute asthma. Abnormal dullness indicates decreased air in the lungs, as with atelectasis or a buildup of pleural fluid. Now assess diaphragmatic excursion.
Exhale and hold
To do this, ask the patient to exhale and then hold his breath. As he holds his breath, percuss from the scapula down to where the sound changes from resonance to dullness. Mark this spot with a pen. Now ask the patient to inhale deeply and hold his breath as you percuss further down to the new area of dullness. Mark this spot too. Repeat this process on the other side. Measure the distance between the set of marks on each side. Normally, this distance, which represents diaphragmatic excursion, measures 3 to 5 centimeters and is equal on both sides.
Now I'm going to
Next, assess the kidneys using blunt or fist percussion over the costovertebral angle. Percussion in this area should not cause tenderness. Finally, auscultate breath sounds with the diaphragm of your stethoscope. To do this, instruct the patient to breathe deeply through his mouth. Starting at the lung apices, auscultate the lungs. Move systematically from side to side down the patient's back and laterally toward the axillae. Be sure to listen for at least one complete respiration at each location.